Okay.
So, chest infection or bronchitis. Yeah, so chest infection, generally you will feel very congested. At the beginning, it can get really, really sore, almost like a burning or even a bit of a muscle ache all around the front, sometimes even in the back, depending where it's located. Possibly can come with fever, but not always. Yeah, and then it's coughing up things basically, and can have color or not necessarily. You can have transparent mucus, but as it goes through the infection, it can go from yellow to green, and some people cough a little bit of blood, depending how much irritation the airways have suffered, and also people with asthma, so they're obviously more prone to chest infection and can already have more inflamed lungs in general, so that's more prone to bleeding. In terms of what to do, so one of the very good things to do at the very start, especially when someone feels congested and they're almost unable to cough, or they cough and nothing comes up and it feels really stuck, is to use this very old remedy, which is actually coming from my childhood. My grandmother used to give us this recipe, which is linseed and mustard poultice. I'm going to demonstrate in the making section how to make that. And essentially, you grind some mustard seed and linseed in equal proportion into a powder, and then put boiling water and wrap it into a cloth. Kitchen cloth is good. And apply it to the chest, and you can apply it to the front, to the back. It's a very good thing to do and to sleep with it. And that is a very quick thing to help bring the phlegm up and loosen the tightness in the chest. Tea and tinctures, highly recommended. I'm not going to go again in the diet because that's always a similar recommendation as the general cold and flu diet part. Good herbs, they are going to be very similar to the throat, in fact. So we want expectorant herbs, which are herbs that helps bring things out. So we've got fennel seeds, really good for that, and often people have that in their kitchen, so you can make a tea, or it's really good if you make a tincture with them as well. We've got red clover, which is really good expectorant. Thyme is good as well, and there's one that I actually haven't done the ID for this course. I'm not sure I will, because I don't think I have it at the moment in my garden. It's hyssop. And if you do work with hyssop, quite often you would have bought that plant or grow it from seed. It's not something you're going to find in the wild, and that's a really good expectorant. The other one is mullein as well, which we've seen. And then marshmallow is also good, as well as for throat. It soothes generally inflammatory condition, and it's really good to help the linings of throat, chest, disinflamed and recover. We still have the usual one like mint, St. John's wort, all the antivirals. I mean, most of the time those chest infections are viruses. And yeah, I think those are the main things. I mean, you can make a cough syrup. I don't like to use sugar. I think for this course exceptionally, I'm going to demonstrate how to make a syrup with some cane sugar that I've got left somewhere in my cupboard. I prefer to use honey, and rather than making a syrup, I usually use a tincture in high concentration, and I add a little bit of warm water to it and dilute it in honey to make a very quick syrup. So rather than having to boil it really quickly, it takes 5 minutes. But again, I will demonstrate how to do that. Yeah, so these are the same thing. In terms of fluid, again, as much fluid as you need, it will help. And the foot bath as well is really important for chest infection, helping to bring heat. There's often a lot of coldness trapped in the chest with chest infection. Is quite funny, that part. So bringing that heat going is really important. And you can also apply some balm. So I mean, tiger balm if you really haven't got anything else, but otherwise make your own with eucalyptus, mint. You can put chamomile if you want, and just to soothe and just help the body bring all of the good fighting cells to this area. That is generally the main thing, and a lot of rest. And I would also recommend deep breathing with chest infection, interestingly. I mean, with the sinuses I don't, because usually the nose is so blocked that it's hard. But with the chest, you can practice a meditative form of breathing to help stimulate things. And even the Wim Hof, I would actually go, it can be quite hardcore in a way, because you might end up in a massive burst of cough, but you know, it will bring things out, and you will just bring all of that oxygen to this area. And it might be a bit counterintuitive in a way, because you might not feel like doing it, but I suggest trying and seeing if it helps. And then, yeah, it's often the same thing as always, is the energy, the check-in. Yeah, that's, for me, that's the most important part. I could be sitting on an island and have no herbs, no food, no nothing, and all I'd have would be myself, myself and my connection to myself. And that's such a simple tool, and yet so hard to do for most of us, because we are raised, I was going to say bred, almost the human species is bred to disconnect and to be, yeah, a breeding stock of non-connection. You know, this is really, especially in this high technological world. So chest is a place of grief. We hold a lot of grief in the chest. It's interesting. That's a very big thing in Chinese medicine as well. The loss of someone, grieving a partner, grieving a friend, grieving any loss really. So that's a really important. I like to be careful about not entrapping anyone into, oh, if you've got chest infection, you're grieving. No, it's not always just that, but it's you know, you don't want to just confine yourself to it, but it's important to just offer, is there something that I'm grieving right now? Just offer that question. Yeah, when you got it, how you got it, how were you feeling, anything specific happened. And then always invite that question, is this familiar? You know, are those chest infection familiar? Is this a new thing? You know, so if so, what's going on? Or is it familiar? Is this something I had a long time ago? What happened in my childhood around the chest infections, or someone else in the family, you know? Basically just trusting that whatever that needs to come forth will come up. It could be really anything. And bringing the plants, I mean today, surprisingly, had this beautiful wood betony coming up. I hadn't noticed it was blossoming. And well, wood betony is a beautiful plant to work with melancholy. So yeah, speaking of grieving, you know, the melancholy of grieving someone. And you can check, what is that plant doing to my chest? What is it inviting? What is it highlighting? So as in, you know, inviting would be, is it bringing space to my chest? Is it expanding it? Or highlighting would be, is there something blocked? Is it something tight? Is it something tensed? What is it? And then sometimes checking with other parts like the heart, because often it comes in the chest, but actually, what is the heart saying, you know? Yeah, and loads of rest, especially with the chest. It's quite, you know, if you're going to be out of breath most of the day, because obviously you will lose a little bit of your oxygen, is remembering to rest. And as you rest, you can invite all these questions. And the last thing that I would say, which is a bit more medicalized, is you can always get this little measurement thing to check your oxygen level. And sometimes with chest infection, people can go a little bit hypoxic. It's not necessarily an alarm bell to ring in terms of you don't need to rush to hospital straight away or anything like that. But you know, anything below 94, 95 can start causing a little bit of damage to the cells. So really be caution there. But yeah, you can fall towards 95. So the normal reading is only 98, 99. And exploring to keep that on, and this meditative breath, the deep breathing, the slowing down and looking how this is reacting. Because often after a few minutes, when we plug the device, I've had patient hypoxics like this, and they do 5 deep breaths, and their oxygen level goes back up by simply taking 5 deep, slow breaths. So I think there's a lot to be said there in terms of the power of taking deep breath through the day with or without chest infection. All right, this is it.